Hey, it's Jessica DaMassa with WTF Health. I'm here at Giant Health, and joining me right now I have Dr. Rebecca Pope. She is the lead data scientist for health at KPMG, and I've also got Maxine Birmingham. She is part of the leadership team here at Giant. So ladies, welcome. I'm happy to take this gift card and go shopping at Harrods. Thank you so much. All joking aside, that's not what this is. What we have here is the healthcare data donor card, and so this is representative of it's a symbolic card that represents data transfer and patients sharing their data. So Rebecca, talk about this and why that's important. Why do we need something symbolic that represents this whole concept of data sharing in healthcare?
Thanks, yeah. So we did some thought leadership at KPMG. We polled the public and we found that actually the public really want to share their data with the NHS and have this interoperability of data. But they have understandable worries around how will my data be used, is it safe, and will it link back to my care? So we came up with this idea, and it's being trialled here at Giant Health around, actually we have bank cards that have information about us and what we do. Why not have a health data donor card, just like your organ card?
I love it. And so what was the response to this, Maxine? Because this was up on stage during a debate. So talk to me a little bit about the response.
Yeah, well, it all came about when we got together to discuss the debate, and we had Matt Eagles from Avis Links also as part of that. And we were setting up this idea of kind of people versus technology, and it was Rebecca who spoke about how KPMG had been working on the concept of data donors. And then we went, oh my God, there is this concept of a donor card, an organ donor card at in the UK, and we thought, well, why don't we translate that into something that physically represents a contract, an open, transparent agreement between people and the healthcare system to do it. So we had the debate, and of course Matt and Rebecca are actually both on the side of people, but it was an Oxford-style debate. And then at the end, Shafi asked, who would like to be a data donor, and held up the card, and actually almost every single person in the room, when you rendered this visible, when people knew what the data was going to be used for, not just theirs, but also their family history is in part of this as well, and the idea is that you'd be able to split that. But what happened was that everybody moved to the other side of the room. It was almost universal acceptance, not only the idea of being a data donor, but also having that physical manifestation of that contract.
So explain to me, I guess, what it is you're donating your data to. Because, I mean, in the U.S. health system, it's like, or in most health systems, it's like, I feel like from the health consumer side, you're like, my data is trapped in there. So how am I even going to get it, and how am I going to donate it? And do I need to donate it if they've already got it? So explain this to me a little bit more.
Just take that one, actually, because in the U.S., they do have a concept called the blue button. And the blue button is a way you go download me, and because you need in the US, because of the way healthcare is set up, you do need to be able to transport your data from place to place for your own personal benefit. So they've now got this, but the symbol they use in the US is about download data, and it's a blue download sign. It's called the blue button. So there's a little bit about that, but it's and I think there are about 1 million people signed up.
It's Medicare only that allows you to do that. Mm-hmm.
Yeah, Medicare. So this is a similar idea.
Okay, so it's like you're not really donating your data; you're just getting access to it.
Well, no, actually, I think it's also about the data sets. I'll let.
All right, so yeah, Rebecca, tell me.
I think it's about, at the moment, I find it very difficult as a type 1 diabetic to go and get my data, and yet I own it. Okay. So how do I get access to my data?
How do you get access to it, and then what do you want to donate it to?
Exactly, and I just think it's unclear at the moment from a person perspective, but also from an infrastructure perspective. The data is siloed, it doesn't go across primary, secondary and tertiary care, and I'm really interested to hear what Matt Hancock has to say about this idea a bit later on.
Yeah. And I think the other thing that came up in the other panel that you ran here, Rebecca, was this idea of dirty data. People are messy. They live real lives. They are not just their electronic health record or their health record. They're not just their conditions. They are, they're adopted. They are, they have other things going on in their lives. They're old, they're young, they're with family, they're isolated. There are a number of different things. All of that bit of data, all of that is what makes it possible to deal with solutions for people, not just solutions for conditions. And I think that's why we have to get the people complicit and compliant in not only finding how they can own it themselves, but then also to understand what its fate and what their legacy is.
How are you pushing the industry? Because typically that's where the problem is. It's like, I mean, in the US, where the open access to data movement for patient data is, I mean, tremendous. And it's gained a lot of steam recently. And we've even gone, we're like, screw donating it. It's like, if you want to use my data for research, you should cut us in and pay for the ability to use our data to do research and things like that. That's so capitalistic and American, that's why. But I'm curious to know, like, how are you guys going to, I guess, flip this and push the system? Because that's really oftentimes where you find the most resistance is like, oh, you know, if it's in the U.S., I can only speak from understanding our health system. It's, you know, the health plan that has the data that doesn't want to give it, or the hospital system that has the health plan and doesn't want to give it or can't give it because the systems are not interoperable. So how are you tackling that?
So, great question. I think it's around a fair value exchange. So the NHS and no one company, however large, can do this on their own. There needs to be an ecosystem of partners, and central to that are us as people that use that service. And I think something that came out in the debate yesterday with Matt is a lot of people, if they know what their data is being used for, aren't interested in it from a monetary value perspective. They're interested in leaving a legacy. And we heard amazing story from Jess Mills today, Tessa Giles' daughter, about her legacy and leaving, the first person to leave data to cancer registries, which was extremely moving. And I think if there is going to be this value exchange, I think there are some commercial benefits that are working very well. So if you use NHS data, then the royalties of that data go back into the service, go back into the NHS.
Yeah, and I think I would agree with Rebecca completely that there are health corporates that are making a heck of a lot of money out of sick people and hopefully people getting well as well. So I think they're the ones that have the budgets, that are in charge of designing the solutions, that use the kind of data crunching that KPMG do. But this, you know, so I think we need to look at who can pay and for the benefit of whom. I think the end user is, and certainly this is one of the reasons why we tapped into the organ donor card. People know that they have absolutely nothing to gain from donating their kidneys on their death. Yeah, and so, but the wonderful thing about data is you can actually benefit from that yourself in your life, and other people can benefit from that in your life. Because if we're looking at population health, we need to aggregate that data to understand the trends and understand what's changing in the world. So I think this is, you know, this is about the greater good, but I think we recognize that in the healthcare system there are corporates that have vast amounts of money that are being deployed to develop new therapies, a lot of new medicinal therapies. Here we have some digital therapies that we know can reduce medicinal drug use. So why not try and change that? But they have to buy into it. The corporates have to buy into it. They have to buy into different life cycles, and they need to buy into different business models and actually different products.
Rebecca, for you, last thoughts here on, you know, what is the thing that is going to be, I guess, the biggest problem to overcome when it comes to implementing something like this, where it's like this broad scale, you know, patients who are empowered with their health data, they're working collaboratively with the health system, with other stakeholders and like the healthcare establishment. What is the biggest problem to overcome? I mean, I know from the U.S. standpoint what everybody talks about, but I mean, here in the UK, what would you say?
I think it's the most important fundamental issue we need to tackle, and I think the Wellcome Trusts are tackling this very well in the UK, is around public and patient or people engagement. Okay. We need to have the conversation and change the tone of the conversation with the people that, you know, in the UK at least, use our National Health Service. And then I think doors will open. All the other, how data is shared across the piece, the NHS can get support, and there's ecosystem of partners, but I think we have to change the hearts and minds of people.
It's so interesting. I mean, we're like the exact opposite in the U.S. I mean, it's like we're like the system, and the interoperability of the system is the thing that has to change first. So it's so exciting to talk about this data issue, this patient data issue, with the two of you, and hear really how this issue is different in a different health system. So thank you so much for sharing your perspective. It's been lovely to hear from you. Thank you so much. I'm Jessica DaMassa with WTF Health here at Giant Health. Thanks for joining us.